Hey, what's up everybody? What's going on? It's Tuesday, August 1st, about 10:30 at night right now. Just kind of doing an update video right now because a few things have happened in the past 24 hours that I just wanted to kind of talk about and address. So now I know I just posted a video about me talking about my MRI and talking about some book reviews, but I also kind of mentioned having a viral infection. And I mentioned how I got it over the weekend and how I was feeling pretty good yesterday with regards to that video. But actually, as the night went on and when I went to bed, I ended up waking up in the middle of the night with a stabbing pain in my stomach. It's probably the worst pain I've ever had with regards to my stomach that I've ever had or experienced in regards to that abdominal region. Wasn't sure what was going on, but it was really bad, really painful. Didn't really end up getting any sleep, maybe a few hours, but just was having trouble sleeping. The only position that was kind of giving me pain relief was kind of standing and kind of certain positions where I was laying on my side that I could kind of manage, but it was just really annoying and unexpected because I was feeling pretty good that day, and then for that pain to just come on like that out of nowhere and to wake me up as well was just, I didn't know what was going on. So anyways, today I ended up kind of taking the initiative, ended up going to emergency to get things checked out because the previous doctor believed that I had a viral infection but wasn't 100% certain. He said if things had gotten worse or anything to go to emerge. So that's what I ended up doing. Went to emerge today, waited about 4 hours to kind of get in. Got some blood work done. Results came back fine on the blood work. The doctor I saw believed that I do have probably some sort of infection, but he believed it may be bacterial. Put me on some antibiotics for 3 days and prescribed some probiotics as well and Percocets for the pain for whenever I need them or whenever I need it if the pain kind of suddenly comes on again. So now it's 10:30 at night, so I got home at about 5, 6 o'clock and took the antibiotics, took the probiotics. I'm actually feeling pretty good right now. To be honest, I'm feeling really good now. Not 100%, but pretty good. My stomach's been fine pretty much throughout the whole day for the most part. A little bit in the morning, it was acting up and around lunch and while I was kind of waiting and emerge. But just kind of wanted to talk about that. And actually tomorrow, I got to go from further testing. I got to provide actually a stool sample to them and see if maybe that may show what may specifically be going on. But nevertheless, this kind of gut issue that I have going on is a little bit more serious than I thought. And now I'm just kind of looking to get 100% healthy with regards to this. And in a sense, it may be just a little bit of a wake-up call that I need to kind of improve my gut health per se, especially with whatever's going on and getting this infection. Keep in mind, my dad was sick the previous week, and so I may have caught something from him, but you never know. Could have ate something just unhealthy or just something that was maybe contaminated, or never know, or just could have been my immune system being a little bit weak, and I just gotta improve it a bit, but we'll see. So we'll see what happens here, and I'll kind of monitor this next few days, and I'll keep you guys updated with regards to that. And also, on the other side of things, I finished back mechanic today while I was in Emerge. So I finished the book while I was sitting there for about 4 hours, just kind of ripped through the rest of the chapters. And I'll share with you guys some good tips or just some things that kind of came to my mind regarding finishing the book. Number one, I get this question a lot, and it's regarding sleeping and regarding mattress. What type of mattress should I use? A firm one, soft one? I get this question a lot, and McGill kind of describes it as everyone's going to be different, and it's going to depend on the individual's kind of comfort with regards to the mattress. Some people may be better with maybe a softer one. Some people may be better with a more firm one. And the key thing to keep in mind is that everyone's shapes and sizes are going to be different. So spine curvatures are going to be different. Their body sizes are going to be different, and that's going to all influence the type of mattress one may need. Now, I personally sleep on something that's more firmer. I just find that's better for my back. And I do not like something that's soft because I find that something with soft, I sink into the bed and I tend to go into more of a lumbar flexion, which essentially isn't good, or at least at the time when I had my kind of sciatic pain and my back pain was not good, or that at least would flare up my pain, that I know would flare up my pain. Another tip that I want to share with you guys with regards to that book also is just the whole model regarding treating back pain and looking at clinicians. So the way the kind of model is set up today, I feel like it's really kind of more business driven, and kind of McGill touches on it too. In a sense, by me meaning business driven, I mean, you have individuals kind of going in for maybe 30-minute sessions, 15-minute sessions, they're meeting with their doctor, chiropractor, physical therapist for, and they're not getting a proper assessment, they're not getting proper treatment. And it ends up just being a continuous kind of process where individuals coming in 3 times per week, every month, for 15 to 30 minutes, and they're not getting much benefits. And all that's happening is just they're kind of feeding into the system in terms of, from a business point of view, is that clinician is just making more money and they're continuously feeding in. And so I think that's one reason why a lot of people aren't getting the proper treatment, is because the model today, it is a lot more business driven. And I think that's why you end up seeing a lot of people maybe not getting better or whatnot. So just wanted to kind of touch on that, but also still staying on that topic with regards to clinicians. McGill in the book talks about chiropractors, physical therapists, massage therapists. He talks about kind of their treatment remedies, and their kind of treatment remedies in terms of using maybe ultrasound, using massage, using laser therapy, manipulations. All these don't fix back pain or heal back pain. They're essentially there to maybe provide relief, but in some cases they may make things actually worse. And if you don't have a clinician that is there to properly educate you about your pain and your pain triggers and your postures that cause pain, and fixing your posture or fixing flawed movements that you have, then you need to find essentially a different clinician or a new clinician, because they're not actually helping you. They may be providing you temporary pain relief, but they're not actually fixing your back. And so there's kind of a point or something as an indication to look out for. Is your clinician actually helping you and kind of removing those pain triggers and educating you about your back pain and what you need to avoid to get better? Well, those things that provide pain relief, such as maybe manipulations, massage, laser therapy, those may be fine and be helpful for an individual skill set as a clinician, but they're not actually what's fixing the back pain. So that's something to keep in mind as well. And lastly, this new book just came in, Low Back Disorders, as we could see. This is McGill's probably most extensive book. This is the one that's kind of more geared towards the medical kind of clinician or rehab specialist, or kind of more the medical community. And it actually came in a big package, as you can see. It came in this big bag here, wrapped in this, and I don't know, such a big bag for such a, I guess, small book. I wouldn't say it's a small book, but such a big bag for a book like that. Kind of funny. I guess that's just Amazon purchases that you make. That's what you end up getting through Amazon or whatnot. So kind of funny, but now that I'm done back mechanic, I will go through that book, and I hope to learn a lot more, and I'll keep you guys updated as to how that book is. And I believe it will be the most extensive, but probably will learn the most from that, in my opinion, I think, but we'll see. And I'll keep you guys posted with how that book is. So that's it for this update video, guys. Hope you guys enjoyed this. And that's it. Until next time, all the best and take care.